We're starting our bamboo massage with warming up the tissue, applying hot oil, gliding up the leg. This helps to relax the client and prepare them for the touch. Then we take the bamboo stick. It should be well lubricated. The client should be draped and feel secure, starting from the bottom of the heel, going up towards the hips, down and up. So the key here is to apply pressure when you go up and release pressure when you go down. You don't want to press too hard when you go down. It's just a light glide helping you navigate the stick towards the bottom of the foot. Then we switch location. Instead of going laterally, we go right in the middle of the calf, up the middle of the hamstrings, and up the glute. Releasing pressure going down and start again. Each movement should be repeated 5 to 7 times. So you can just divide the leg in 3 compartments: the lateral, the medial, or more like lateral, posterior, and medial. So that would be your guide. We want to make sure that we touch every compartment 5 to 7 times. And then we glide up the leg, we stop, we do a sweeping motion, and we'll see it again. Sweep and back down. Now we'll repeat it again, releasing pressure around the knee, going up, sweep, and going down. Make sure every move you release pressure around the knee and when you're doing the glide down. So next we're doing around the greater trochanter. We're doing this movements kind of gliding up the glutes, sweeping motions up and down, not directly on the greater trochanter, but above it and then below. Now we're doing the same around the IT band, making sure the client is comfortable with the movement. And this is my favorite move. It helps with the blood flow, circulation, any tension in the glutes. You just go in fast, really, really fast around the glute max. Releasing pressure, going down, up, and releasing pressure, going down. This is one of the best ways to relax the client. Light deployment, but this can be done on all the areas. All right, going up the back, light effleurage to warm up the tissue. Just do your regular introductory strokes. It can be a little faster because bamboo massage is a little bit more invigorating. So all the moves that you do can be a little bit of a faster pace. But you don't have to follow certain rules. It's just your regular massage with warm oil, and then we begin with the bamboo. I usually start with the glide along the erectors, but here for some reason the video just starts right at the QL area, going back and forth and then going up the erectors down the scapula. Then we move to the traps, you anchor it down, and then you glide in between the scapulas along the erectors. And then without touching the spine, only on one side of the erector. You go up, holding it in one hand and pressing with the palm of the other hand, or you can even hold with both hands. Over the scapular, very nice movements without touching the spine of the scapula. You go up and down in infraspinatus, and then again going down the QL, not pressing on the hip bones. You definitely should ask the client about the pressure and make sure you don't touch any bones that are sticking out. Here I put the arm down and glide over the triceps, and then I can go back to the trapezius. Here is the other side. We're doing the glides, repeating the same things, glide over the triceps, the QL, then the scapula, making sure you don't hit the bones. If you feel like you hit the bone, just pat with the palm of your hand and apologize and say sorry and just move on and keep going. So bamboo massage is really great for the stomach area, and it's so easy to do because there is a lot of skin rolling involved, and if people have scar tissue, it's also great for there. It's a little bit of a different technique than myofascial release. It's faster, but it helps to stimulate the stagnant lymph, if there is any there. Because it's light, it's on the skin level. You're not going hard with the stick, just doing it on the skin level. You can ask the client to firm their abdominal muscles if they want, and that helps to relax all the areas in the stomach area. So it's just back and forth, back and forth. It looks intense, but it's very light movement. It doesn't have to be like painful or anything like that. We can add a little bit of skin rolling with the hands too. We can add some abdominal massage technique for digestion and finish up with the dry brushing. It helps to exfoliate and at the same time helps to move the fluids in and around the lymph nodes. You kind of divide the stomach in two areas. The upper area will go towards the armpit lymph nodes, and the lower area will go towards the inguinal lymph nodes. Here it's just circular motions around the belly button just to help with digestion. A little bit of skin rolling. Very nice and relaxing, soothing massage. There's nothing painful about it. It might get a little red, but it's done only with the comfort level of the client. I'm doing the C shape motion with the thumbs, and I'm going around in the clockwise motion, standing at the left side of the table. And then you're doing the knuckling with your knuckles, just helping with the distribution of the interstitial fluid in the skin, or whatever fluid it is in there. Okay, now we do the dry brushing on the legs, going up, Smooth motions to help the client relax. You touch all the compartments of the leg, lateral, anterior, and medial, just helping with exfoliation and is supposedly helping with the lymph flow. Okay, so now I'm grabbing the bamboo stick, I think, or a little bit more oil before we do the bamboo massage here. We add oil as we go because dry brushing requires no oil. Bamboo massage requires oil. The stick should be lubricated unless you're doing trigger point therapy, which you can. With the end of the stick, you can kind of get into those muscles and work out adhesions or very sticky points, any trigger points. Just make sure it doesn't slide and doesn't bump onto the bone. Now I'm going to do some work in the areas of the leg that are more tense here. For runners, that would be quads. For skiers too, we can start this massage with the skin rolling. It really helps to relieve any fascial adhesions. It's included in a lot of French treatments with that aim to help with cellulite. Here I'm doing the skin rolling in the perpendicular direction of the muscle fibers. It feels a little bit like pinching, but it's not very intense. It's the same thing, C shape, skin rolling in the opposite direction. And I'm going into the TFL, and I'm going to the attachment sites of quads, and then going down along the IT band. Nice. Now I'm taking my knuckles and I'm going up with the motions along the sides of the leg. It just helps to relieve the pressure in the around the knee and in the quads. Next step is going up and trying to get rid to the attachment muscles. Because of the camera and privacy concerns, I can't really show you how to get into the attachments of those muscles, but ideally you would want to go up to the very attachments. So finishing up with some deportment, we're moving on to the anterior leg, doing the same things to the tibialis anterior. And here I'm back at the front of the leg, draping it, and we're moving to another leg. Sweeping up with the brush, it helps to exfoliate this one. Always started with the non-lubricated skin on top of the dry skin. So what I'm doing is I'm sweeping with one head and gliding with another. It gives the client reassurance that I'm still using my the warmth of my hands. It kind of makes a signal, sends a signal to the brain that it's still like a massage, but a little bit with the different tool and approach. So it's a superficial massage, it's not deep. All lymphatic work is always superficial because lymphatic capillaries sit on the surface of the skin. We don't do deep work when we're doing anything lymphatic, because with lymphatic work we want to activate those capillaries, not the muscles, and some people are surprised how light their work is. Moving on to the arm, I have one of the thumb sticking out, and it goes along the flexors, and the other part of my hand is going along the extensors. The same I'm doing with the hand. One part of the arm hand is brushed with the brush, and the palm of the hand is massaged with my thumbs, which makes client relaxed, at the same time helping me with my work on dry brushing and sending and exfoliating and sending the signals to the brain that they're getting a double work done on them. So now we will move on to now we're moving on to the décolleté area. In the décolleté area, I'm usually using some cream instead of the oil, and just doing a light milking motions towards the armpits where the lymph nodes are, and then sweeping up the shoulders, around the shoulders and up the shoulders into the neck, getting the back of the traps, trying to relax and soothe the client's nervous system, sending signals to their brain that the work I'm doing is going to be light but effective. Now we're moving on to the neck work. Neck work is my favorite work because here I can go right under the shoulders, right under the neck, under the head. I feel like it's the best way to finish the massage and make your client leave relaxed and rejuvenated and come back for the next session.